This is Sarah, and I just want to take a moment to speak to you about this week's sponsor, Favor. Favor Inc. is a statewide family-led nonprofit 501c3 organization that is committed to empowering families as advocates and partners in improving educational and health outcomes for our children. Favor is the Connecticut state organization of the Federation of Families for Children's Mental Health. Favor offers a single place for families with children who have medical, mental, emotional, and behavioral health challenges to find information, assistance, and training. To find out more about Favor, please go to favor-ct.org. We are grateful for our opportunity to work with Favor as a sponsor, and now on to the rest of the episode. Hello, everyone, and welcome to Caregiver Chronicles. My name is Sarah, and I am super excited about my guest today. Her name is Patti LaFleur, and she is a family caregiver. She is a former teacher, and she has a fantastic website that includes tips and tricks for caring for family caregivers. She's also a volunteer for the Alzheimer's Association. Hello, Patti, and welcome. Would you like to further introduce yourself?
No, I think you covered a lot of it. I am a former family caregiver for both of my parents, and then both of my parents have since passed, but I am still continuing to advocate for caregivers and people living with dementia and Alzheimer's.
Awesome. Thank you so much. I love that you're here. You have such a great spark and such good positive, like energy. You're just a very happy, light-hearted person.
Thank you.
So you were a caregiver for your parents. Would you like to talk about that journey?
Yeah. So I was the caregiver for both of my parents. My mom got diagnosed with dementia 8 years ago, and my dad was able to care for her in the home for a long time. But about 3 years ago, I really stepped in to help care for my mom, and that ultimately led to her moving in with me. She was in the mid-stage dementia when she moved in with me, and then lived with me for a little bit over 2.5 years before she passed. She had mixed dementia and type 1 diabetes, so that was a very complicated combination that required a lot of support. I taught for the first year that she was living with me, and then I quit my job and became her full-time caregiver. In addition, once my mom moved in with me, we really started to notice that my dad also needed some supports. And so he also ended up getting diagnosed with dementia. And so he moved into an assisted living facility, and I supported from long distance while still caring for my mom.
And that must have been insane. And most of this happened during 2020, during the COVID pandemic. Do you want to talk about how that complicated things?
Yeah, I mean, the pandemic made it extremely complicated. It made it complicated because my mom and I just immediately became isolated. She was high risk between her age and her type 1 diabetes. She was high risk. So it was very risky, for lack of a better word, for us to do a lot of things. We ended up staying in the house a lot. It was very confusing for her to wear a mask and really understand that she couldn't do the things that she was used to, hugging people and touching everything. So it became a safety concern. In addition, during that time was when we were looking for support for my dad. And so it was extremely concerning to be considering putting him in a facility at that point because of the limited visitation, because of my mom and him being high risk, and because you just don't know. You don't know. We didn't know much about the pandemic or about COVID, I guess, at that time even. So it was really scary and risky to have them be living at that point. I mean, it was just a really hard time. And as a caregiver, it was extremely isolating. I didn't feel super comfortable having a bunch of different people in to care for my mom. I didn't feel comfortable having her go to a facility and do respite. There were no day centers that were open. So my options for care for her were very, very limited and scary. I mean, really,
Yeah, absolutely. And I totally, and I understand that too, because we went through a similar situation with my grandmother with isolation. And, unfortunately, during the pandemic, I watched my residents in isolation and stuff like that. And I know caregiver burnout, like, is always exacerbated by isolation. I feel like even pre-COVID, caregivers, especially of family members with mobility issues, struggle with isolation. And this must have exacerbated it tenfold.
Yeah, I mean, the thing that was a little bit helpful was that everyone was staying home. And so there wasn't this thing where I was like, oh, my friends are out doing all these things and I'm just at home. But on the flip side, it meant that we were even more in lockdown than other people. I mean, we were very, very careful about the people that we spent time with until she got vaccinated. We were very careful about what it even looked like once she was vaccinated and we were spending time with people. So it was like the whole world was isolated, but then we were like even more another layer of isolation. We couldn't see her friends. We couldn't, maintain any of the things that were very helpful for her in her dementia.
And how, again, I can totally relate to that. And I still know families who are still, because they're unfortunately people still are getting COVID. And I know people who are
Yeah.
still immune compromised, and either they're immune compromised to the point where they cannot get the vaccine because it would be a safety risk for them, or they're immune compromised. And even though they have been vaccinated, they can still get very ill. And I unfortunately do know people who are still quarantining, who still have to kind of isolate, step back, still wear masks in public, still be very careful. And we have to, as family caregivers, we have to extend our hearts out to them because
100%.
it's not over for some people. The rest of us, sure, I'm sure you've started to go back to normal. You know what I mean? Like we mostly have, but I know that there are some people that this is not over for. This is still a death sentence for them, and it's very unfortunate. And it should bring awareness into the forefront, that caregiver isolation and how severe that can be, because we don't realize, the rest of
Yeah.
the world just doesn't realize it.
Yes, 1,000%. I think that's a great point to bring up, is that there is still so many, even, I mean, I will say, even for my mom and I, when some of the mandates were lifted and she was vaccinated, I mean, we still were wearing masks, or we were still making choices to stay home, or being really careful about where we went. And I think it's really important that we don't just say like the pandemic's over and all restrictions are lifted. We have to really be very cognizant and thinking about others and who still is impacted, and how we can make sure we're supporting them and being understanding. I mean, having some empathy for that piece even.
Absolutely. And also I want to ask a little bit about that overlap in caregiving that you had. And I know you had it probably the most difficult time ever. But can you talk a little bit about how your experience caring for your mom maybe helped you realize things with your dad faster, or maybe helped you know how to advocate, anything like that?
When my mom moved in with me, I was extremely lost on what even to do. At that point, she was in her mid stages. And so she required a lot of help. She required help with the bathroom and showering. And I mean, a lot of the things that you would need help with as a person. And so I just didn't really know what to do to support her. She had already progressed pretty far along. And so I think that was really helpful for me, because I realized that my dad was needing more support, but I didn't want him to get to a point where his dementia had progressed to that point. And so I didn't want him to stay in the home. I didn't want him to be in a place where he wasn't receiving the support and help he needed. So by moving into a facility, he was able to actually move into the independent side, even though he had the dementia diagnosis, because he was still so early on in his dementia. And by them taking away him having to worry about cooking dinner and worrying about having his medications brought to him and worrying about bills, by taking those pieces away, it allowed him to stay so much more independent. Whereas with my mom, because of the way my dad cared for her and because we didn't know, I mean, we pretty quickly stripped a lot of her independence away from her. It was like, you can't help with dinner. You can't, like, my dad was really big, like, you can't make phone calls. So he had like taken her cell phone away. Whereas if she had been allowed or given the opportunity to remain independent, I wonder how her progression would have looked, if it would have looked any differently. Whereas my dad got placed into a place where he was able to thrive. And so because he was able to thrive, before he passed, his dementia never really progressed super far. He was still very much in the early stages of his dementia because we knew what to identify and how to create a environment that allowed him to be independent. With my mom, she moved to the mid stages really, really quickly and lived in the mid stages for a long time. But in living in the mid stages, she required a lot more help than my dad did, even at the end of his life.
Yeah, no, and I have seen that a lot as a healthcare worker working with dementia patients and working in an assisted living facility. I've seen people in the beginning stages stay in the beginning stages for a very long time where the dementia just is kind of plateauing. I'm sure you know enough to know that it does, it's not just a slope downward.
No.
It goes down and then it kind of plateaus for a little while and then it might go down, or they might even have a couple of really good days or spikes where maybe there's an infection that causes them to go down. That infection cures and they get back up to baseline sometimes. And then again, you see people plateau in the mid stages and even unfortunately in the late stages. And that's always the hardest for me, is seeing people kind of plateau at that late stage where they're no longer able to walk, they're no longer able to communicate, no longer able to chew solid foods. To me, that's the hardest part of dementia. That's the worst place to plateau. But everybody has different feelings about this too. The middle stages can be really hard too, because you have to worry about wandering, you have to worry about physical them hurting you, not so much that they're intending to, but verbal, emotional abuse and physical abuse, because it does happen. They may become violent. Have you experienced any of those things with your mom?
So my mom was not violent. I was very fortunate that throughout her whole progression, she really stayed pretty true to the person she was her whole life. I will say, when she was living with my dad and it was not the best situation, there was a lot of yelling that she would do. She would wander. She would take things. So it was a lot more that place that she was at was not the right place for her. And so she was really not able to thrive with my dad as her caregiver at the end. When she lived with me, her sundowning and her negative behaviors were really presented in sadness and confusion. She cried a lot. Crying was a really common way for her to express her negative feelings. She would cry. She wouldn't know why she was crying. She'd wake up in the middle of the night scared and crying. She woke up a lot. She was very confused and very apologetic in those moments. So she really presented from a place of sadness, than as opposed to a place of anger or frustration. She also really didn't wander when she lived with me. She was always really big into safety. And I think that is why she didn't wander. I mean, she just was one of those people that she was afraid of everything. She didn't like to go and do things by herself. She liked to have someone else with her. So those kind of things actually stayed with her as her dementia progressed, because they were who she was as a person, which was extremely fortunate for us because we didn't have the wandering, but we did have lots and lots of crying and sadness and just really inconsolable and unable to breathe at points because she was crying so hard.
Yeah, absolutely. And sometimes you see the full personality change with dementia where someone, especially with different forms of dementia, you tend to see this a little bit more. But maybe it's not so much of the person's forgetting where they put their keys, which is something I'm guilty of all the time.
Yeah, right.
Maybe Yeah, maybe it's more like they all of a sudden don't like going to the movies and they used to love it, or all of a sudden they're taking their clothes off and they were a complete prude before and they're flashing people. It's kind of it's there's a little bit of humor there, but not really. When it's your parent, it's incredibly embarrassing and stressful. But there's, you have to care for someone with dementia, you have to have a sense of humor and a lot of compassion. And
you have to be able to really just like not take things too personally. You just kind of have to be able to brush off a lot of things and know that most of the time, even some of the like negative comments or some of the like outbursts and things really are coming from a place of trying to communicate a different feeling, right? I have started volunteering for the art class that my mom was in, and it's for people living with dementia. And I work specifically with one lady. And one of her favorite things to say to me when she's mad at me is that I'm effing ugly. Like she just will repeat that over and over to me. And I just have to remember that like, she doesn't think that. I just have to let that go. It's not what she's saying, but there is some unmet need behind what she said. And what I found out often is like, she's trying to put something in her mouth that she's not supposed to, but she's probably hungry. So I've started having snacks ready for her so she can just have a snack, or she's tired or frustrated. It happens often at the end of class because she's ready to go home, So just really remembering that the things that they're saying isn't necessarily what they mean. My mom never cussed in my whole life. Like maybe I heard her 2 or 3 times, and she actually used curse words as her dementia progressed as a way to express she was mad or frustrated. She would say things that we never heard her say. I mean, my husband and I would laugh because that was just not her personality. And she'd say something and we would be like, okay, she's not happy. Like, what can we do to understand? Because she didn't have the words to be like, I'm unhappy because you didn't give me ketchup, or I'm unhappy because I'm thirsty. So we had to really look at what was going on in that moment and try to meet the fact that she wasn't happy in that moment. And that was her way of communicating it.
Yes. I have been there many times with dementia, even my own grandmother, not just at work, but even in my personal life. My own grandmother, her favorite phrase at the end was son of a B word. And she would repeat that word over and over and over again. And she wanted to be a nun. So, it just says so much. And, I know you just mentioned your husband. You're young. You're in your 20s still, correct? Or
I'm in my mid-30s. Yeah.
Mid-30s. Okay. But you're still young. And all of this is happening at like an important time in your life when you're, an adult, a young adult, still an adult. We're very close in age.
Yeah.
And all of this is happening in your adult life, and your mom's diagnosed with Alzheimer's and you're getting married. How did that impact your life plans?
It was really challenging. So the year that my mom got diagnosed with her dementia, it was the year before my husband and I got engaged. And I was also working on my master's and working full time and trying to plan my wedding. And so it became really complicated because I really wanted my mom to be involved in this process. So my way of like handling all of that was that I just really avoided. It was like, I don't have the mental capacity to really process my mom's dementia. Well, I'm so excited about getting my master's and getting married and all of these things. But what I learned was that like by trying to avoid it, I wasn't processing it. I was just really feeling very sad about it. And Such a Happy Time had this kind of like sad piece to it. And so that is one part of it, right? Was like the sadness I felt and the grief I felt in missing my mom in those moments. And then really my husband getting thrown into something with my mom moving in with me that wasn't in our plans. I mean, we've only been married for 4 years, and my mom moved in with me and my husband like a year into our marriage. But it was his idea. He was the one that was really like, she needs to live with us. I want her to live with us. He had lost his dad a couple years before we got married. And so he really understood like, I'm not going to have this opportunity to spend this much time with my mom. And he would have done anything to have had a couple more years with his dad living with us and caring for him. So he really was the one that viewed this as an opportunity for us to really spend more time with my mom. You know, I mean, dementia is a progressive disease and it ends with the person passing away. And so we knew that that was something that was going to happen, but we didn't know how much time we had. And so he really encouraged me to have her move in with us. But also it's important to name that in doing so, it really changed our trajectory, right? Once we got married, we were like, we're going to start a family. We're going to start talking about having kids. And we did try some, but we didn't really, you know, I was caring for my mom. So I was so tired all the time. My stress levels were off. So, I mean, we just haven't gotten pregnant yet. And I mean, I'm so thankful because I don't think I could have had a small child and cared for both my parents and it like been mentally okay. But it really has changed our trajectory that now, you know, we're 36 and we're like, okay, like, are we starting a family? Is that something that's happening? Is what's next? Because these last 4 years have been about my parents.
Yeah. And that's, you know, a story that I think most family caregivers can relate to is I planned on doing this with my life and now I'm doing something else. And
100%.
I appreciate you for being so candid about that because I know that that can be a very sensitive topic for people also to grieve, to talk about grieving plans or to talk about grieving a family that maybe you thought you were going to have that you don't, or a career you thought you were going to have and you don't. And I also know too that caring for your parents impacted your career as you left your teaching job. Is that something you see yourself going back to, or?
Yeah, that has been a big crossroads in my life. So I love teaching. I taught for 10 years. I got my master's in instructional leadership. I was a very like skilled teacher and very connected with my families in the community that I was teaching in. But when my mom moved in with me, I tried to do both and it was extremely impossible. And so when I stepped away to care for her, I had no regrets at that point. I was so thankful and so excited that I got to care for her. Sadly, she ended up passing so quickly. But I always told myself that I would give myself about 6 months after she passed to really make any big decisions on what would be next for me. And it's just at that 6-month mark now. And so I'm really just trying to decide kind of what's next. At this point, I think that I'm going to do some substitute teaching, maybe a couple days a month or a couple days a week, and kind of see if that's my passion. And I've really been spending some time thinking about like, what is the advocacy piece that I can do for people living with dementia and Alzheimer's and caregiving. I've created a decent size social media following. And so really just like, how do I use that platform to really advocate for others? And I want to continue volunteering. So I'm just kind of at a crossroads where I don't really know necessarily what's next, but I do have just like some things that are keeping me going.
Yep. And I can relate to that myself as a caregiver, a parent, and someone with multiple interests. So I can relate to being in that crossroads. Where does all of this skill and all of this training, where does it lead me? What do I do with it? Whatever you choose to do, I know you're going to be great at. So
Well,
I will
thank
say that.
you. Same to
Um,
you.
Thank you. Um, so I want you to talk a little bit about your volunteer work with the Alzheimer's Association.
Yeah, so I started volunteering with the Alzheimer's Association about a month after my mom passed. And I am a community educator for them. So I am doing presentations for people specifically around communicating with people living with dementia and other Alzheimer's and other dementias, and behaviors that can occur with people living with dementia. I do about a presentation a month for them. I am really excited because next month I get to do my first in-person presentation, and it's actually going to be at the Northwest Dental Conference. So it is going to be a presentation for dentists and dental assistants and people in the dental industry around communicating with people living with dementia. And I think that that is going to be really powerful. In my work with them, I have had the opportunity to really focus on trainings for kind of trainings more for professionals that are supporting people living with dementia. So that has been really awesome because it's not necessarily for family caregivers who have these relationships and have these connections with the people. It's for people that are really out there interacting. And for me, when I was caring for my mom, I was shocked by how little people understood about people living with dementia, especially in the medical field. The way that people interacted with my mom, physical therapists, occupational therapists, nurses, doctors, secretaries, dentists, like all of those places, I expected them to have a little bit better understanding of how to support someone with dementia or Alzheimer's, and they didn't really. So I'm really lucky and fortunate that now in this role, I'm getting an opportunity to really address some of those needs and concerns that are out there in the community. In addition, it's just been a really like a kind of a full circle moment for me, and just really using my skills as a teacher and educator and using my passion and like empathy for people living with dementia and advocacy to really kind of cross paths and just really support other future caregivers and people living with dementia.
Awesome. And you said something about people in healthcare who work in healthcare not knowing and understanding dementia as well as you would have thought. I think that I want to say that I agree with that statement with this exception. In a long-term care facility, those nurses, aides, and nurses who are working with dementia every day tend to have the best understanding. But then once you get outside of that long-term care facility, the rest of the medical community really, really struggles with understanding dementia care. And I say this, I find that with autism as well. And I don't mean to, well, no, I do want to tie this in together because it's so important. When you leave the specific people who work with autism and you go to a dentist, or if you're an autistic adult who needs to be in a long-term care facility, the staff in that long-term care facility understands dementia, but not autism. This is like a huge point that you just brought up. There are major gaps in healthcare with different specialties and how we treat and care for people, even though we may be caring for people collectively who fit under one or multiple categories. And I just really, again, wanted to highlight that because that is something I've seen taking my grandmother to get 2 doctor's appointments to the hospital. I've had nurses in the emergency room when I was sitting there with my grandmother. Well, there's nothing we can do. She's old. She's Alzheimer's. There's nothing we can do. And it's like, okay, but can we make her comfortable? Like, can we, do something? No.
Yeah.
And it's just, it's very frustrating to see that.
Yeah. I almost feel like it's a compassion piece that is sometimes missing, maybe like bedside manners. Like it just really feels like there could be this opportunity to just really pause and take in who the person is and some understanding of that. I would say that for us, the hospital was the worst experiences. I mean, you're talking about that with your grandmother, the worst experiences supporting my mom. Just like clear lack of like they just didn't understand her. They didn't understand dementia, and the way that they spoke to her and spoke about her, and even the phrases that they used to describe her just are not how you treat a person. Like, I just think that there's this piece around compassion and respect that was missing. Like, they didn't have to have all this training, like the wonderful people in long-term care facilities or the people that work. My mom was in a memory care for respite, like those people were incredible. They have this understanding. They don't have to have years and years of training, but they have to have some compassion and respect and just even some basic understanding of what dementia is and what that means for her.
Yeah. No, I can wholeheartedly agree with everything you're saying as someone who has been on both ends as a family member and as a professional, and professionals outside of caring for dementia come in and be like, they called me a bitch. Well, yeah, they call everyone that, what I mean? Like, everybody's the one to them. That's how they greet you. It just is. And it's, and it's something, again, it's something that I see overlapped with other specific health, mental, cognitive conditions. It's just an overlap that I see. So
yeah, I mean, just even the words that are used, right? Like my mom in the hospital was like labeled as aggressive, and I don't even remember. I can't even remember the other word. I'm gonna have to think about it.
Combative?
But it was like,
was it combative?
Not combative. It was like basically that she just like was choosing to not respond. Like she was choosing. I can't remember the words, but I was like,
yeah.
That you cannot say that. She has dementia. This is not her fault. Okay, don't be labeling my mom. I'm like, and also don't be talking about my mom while she's right there. Like, no.
Yeah. No, absolutely. I completely get and agree. So what do you think the biggest lesson that you learned through all of this was?
I think that the biggest lesson I learned was around patience. I think that I learned a lot about being patient with others, being patient with my mom, and being patient with myself. I think that I really gained an understanding for love and what it really looks like to be selfless. My mom adopted me when I was a baby, and she was one of the most selfless people I know. And she provided this beautiful environment for me to thrive in. And I guess I never really understood how much went into caring for another person, whether they're a child or an adult or whatever it is. So I learned a lot just about having some patience and compassion with other people. But I also learned a lot about having patience with myself. It was extremely challenging to navigate caring for my parents by myself. My sister was not involved. I didn't have any other family members involved. It really was like all on me. And I just struggled a lot. I didn't know what I was doing. I felt really guilty. I felt like I wasn't doing enough, or I was doing too much. And I lived in this space for a really long time until I really was able to stop and think like, you're doing the best you can. And it is important that you honor that about yourself, and you give yourself the same patience you give others. And it really, really helped me to understand that 99.999% of people in the world are doing the best they can in any given moment. My mom was doing the best she could with her dementia. She was not trying to make my life more difficult. She really was trying to do the best she could, but she just had a neurocognitive disorder that was getting in the way of her being able to help herself or make decisions or say the right thing, you know? And most people really are doing the best they can. So it has given me a whole new like outlook on the world, and just really having some patience and compassion for others at the grocery store, at the dentist, at the doctor's office, anywhere I am. Like, people are really just doing the best they can, and you never know what's going on in their life or what's going on with them as a person. So just give everyone a little bit more patience than you might typically do, and it will make the whole world such a better place. I will say, like, 5 years ago, if I was at the grocery store and the person in front of me what appeared like they were going to take a long time, it could have been because they were older or because they were in like a scooter chair or whatever it was. I honestly would have avoided that line. I would have never gone in that line. And now I search them out. Like, I'm like, what person do I think could potentially take a little longer and someone else could get really frustrated with? Like, I'm going to go to that line. I'm going to help them. I'm going to smile at them. I'm going to make them realize, like, take your time. You're doing the best you can. And it has been just such a blessing for me to really have this new understanding and outlook on patients.
I know, I love that. Just when you're at the grocery store, just be kinder. And I'm guilty of what you said, especially when I have my kids with me, of finding whatever line I think is going to be the shortest. If I see someone whipping out a checkbook, I'm like, I'm definitely not going there. I hate self-checkouts, but I'll go to a self-checkout before.
Yeah.
If it's just me, it's not that big. I don't care as much. Usually I want that longer line if it's just me, because it's like, ooh, I'm by myself. It's kind of nice. But if I have my kids with me, forget it.
Yeah. Oh, you can't.
And it's just, and I know that feeling of being the person on both ends, being the person of who needs the help, because I'm so flustered because I had a horrible day and I'm burnt out and I'm trying to function, and I'm just there. And when someone extends you just a little bit of kindness when you're in that moment, you are just so grateful for it. It really can impact the rest of your day and bring you back into gratitude, and just in a better space.
I was shocked at how many people were not super like helpful with my mom, specifically when I was going somewhere, when I was pushing her in her wheelchair and they wouldn't open a door for me. They'd be like right there, or we'd be going into a restaurant and they wouldn't open a door. And so they would just watch me struggle with the door. And so now I'm like so aware of those things because now I'm like, wow, a lot of people don't help. And so now I'm like, how can I help? Where can I get the door? Like, what? I'm so much more aware. And I think that is such a blessing. And I do really feel like that was what someone wanted me to learn throughout this process.
Yeah. And I would agree. And you're just a very happy, like, kind person, or at least you appear that way in our interviews, just very happy and kind. And and I really admire that about you. What is now, through all this, you have to take care of yourself. So what is your favorite self-care technique besides being kind to strangers?
Yeah, I'm like, I don't know how much self-care that is. Honestly, the biggest key for me during this whole process was finding support, finding a person I could talk to, finding a group of people I could talk to, like finding a support group, finding people that get it, talking to a friend. Like, for me, the social aspect or the connection piece, so that I didn't feel alone. I was so isolated during the whole process, right? Like, we were stuck at home. So I just really needed to have someone that I could talk to and that would get it. My friends were amazing and wonderful and so helpful in so many ways, but they weren't going through that. They were caring for a small child. They still had their parents, all these things, right? So my friends, although as amazing as they are as people, they just weren't able to get it. So finding people that were my age and were going through the same thing was the biggest lifeline for me. And really my biggest form of self-care was that connection, and even just the awareness that I wasn't the only person doing this.
Yeah. In that, like, you being younger, you're a millennial caring for parents with dementia. Millennials still aren't quite, we're just getting started with having to care for our parents. We're all 40 or barely 40. I say this as well. And I couldn't imagine caring for my parents just yet. My parents are only in their 60s, and some days my mom insists she's in better shape than me and everyone else she knows, which is great. And I'm proud of her for that. But, that, like you said, you being in your own unique experience with your family, that's a whole other level of isolation in addition to the pandemic. I'm glad that you were able to find a community of other, younger family members who were caring for parents with Alzheimer's. And I'm so glad that you found that. And again, I'm a huge advocate for support groups because that's helped me as a parent.
So helpful.
Is there anything else you would like to share with my audience?
I think it's just really important that people hear that they're not alone. So caregiving can look so different. You can be caring for a child, you can be caring for a parent, you can be caring for a grandparent, you can be caring for a friend or an ex-boyfriend. I mean, you could be caring in so many different aspects and different ways, but there are so many of us out here that are caring and trying to figure it out, and we're all doing the best that we can. But just knowing that you're not alone, you're not the only person that's trying to figure it out. And just remember, you're doing the best you can. Don't compare yourself to other people, and just keep on keeping on, for lack of a better phrase. Like I see you, I hear you, I get it.
Absolutely. And you mentioned your Instagram, and I've been following you on Instagram. You have a great account. Can you share your Instagram account and also where my audience can find you?
Yeah, I'm on Instagram. It is Miss Patti Cake, which is MISS Patti PATTI Cake CAKE. It was my personal one, and it's transcended into this. And then I'm also on TikTok as Care Partner Patti, which is just Care Partner, and then Patti PATTI.
Well, thank you. And I think that Miss Patti Cake really is a great name for you though. And it's super I don't know, it makes you smile. You can't say
yeah.
It's
it's nothing about caregiving. It was not ever meant to be about caregiving. It is just my personal account, but then it transcended into this because my mom lived with me, right? So I started sharing about her, and now look at where I am.
And I think that that's awesome because you know what, that's exactly what happened to your life. Your life wasn't about caregiving, and then it was.
Exactly.
And I am just, again, like I said, you are one of the just kindest, happiest people. And I am just thrilled that I've gotten to chat with you and stuff like that. I want to thank you so much for coming on. I'm going to link your website and your social media accounts in our show notes. And that will wrap up this week's episode of Caregiver Chronicles. For more information, you can reach out to us at caregiverchroniclespod@gmail.com. You can find us on social media. We are Caregiver Chronicles 2 on Facebook and Instagram, Caregiver Chron 1 on Twitter. I am on TikTok as Sarah Stelmack Brown. You can find me there. If you really like our show, you really like what's going on our show, you can support us on Buy Me a Coffee. If you can't do that, I totally get it. Like, share, and subscribe. And the best way to support our show really is to just share it with a friend. Thank you so much for listening, and I'll see you next week.